In this video, we are going to discuss about the P wave overview, characteristics of the normal sinus P wave, the atrial waveform and its relationship to the P wave, normal P wave morphology in lead 2 and the V1, P wave changes in the right atrial enlargement and the left atrial enlargement, both in the lead 2 and the V1, common P wave abnormalities like the P mitrale, P pulmonale, P wave inversion, and the variable P wave morphology, such as the multifocal atrial rhythm and the multifocal atrial tachycardia. The P wave is the first positive deflection on ECG and it represents the atrial depolarization. The characteristics of normal sinus P waves are morphology, it is smooth in contour, monophasic in lead 2, biphasic in V1. Axis, normal P wave axis is between the 0 degree to positive 75 degree. P wave should be upright in the lead 1 and lead 2 and inverted in the AVR. Duration should be less than 0.12 second, that means less than 3 small squares. Amplitude, in limb leads it should be less than 2.5 millimeter or 0.25 millivolt, and in precordial leads it should be less than 1.5 millimeter or 0.15 millivolt. Atrial abnormalities are most easily seen in the inferior leads. Inferior leads are 2, 3 AVF and also seen in the V1 as the P waves are the most prominent in these leads. Atrial depolarization proceeds sequentially from the right to the left. Thus, the right atrium activated before the left atrium. Right and the left atrial waveform summate to form the P wave. The first one-third of the P wave corresponds to the right atrial activation, the final one-third corresponds to the left atrial activation, and the middle one-third is a combination of two. For example, in the lead 2, the right and the left atrial waveforms moves in the same direction, forming a monophasic P wave. However, in the lead V1, the right and the left atrial waveforms moves in the opposite direction. This produces a biphasic P wave with initial positive deflection corresponding to the right atrial activation and subsequent negative deflection that denotes the left atrial activation. This separation of the right and the left atrial electrical forces in the V1, that means that abnormalities affecting each individual atrial waveforms can be determined in this lead. Normal P wave morphology. Right atrial depolarization waveform shown in the red in color, left atrial activation shown in the blue in color. The combination of this right and the left atrial depolarization wave that forming the P wave is less than 120 millisecond in width and the less than 2.5 millimeter in height. Right atrial enlargement. In right atrial enlargement, the right atrium depolarization lasts longer than the normal when the right atrium is normal in size, and its waveform extends to the end of the left atrial depolarization. Although the amplitude of the right atrial depolarization current remains unchanged, its peak now falls on the top of that of the left atrial depolarization wave. The combination of these two waveforms produces the P wave that is taller than the normal, that means the more than 2.5 millimeter, although the width remains unchanged, that is less than 120 millisecond or less than 3 small squares. In the left atrial enlargement, the left atrial depolarization lasts longer than the normal and its amplitude remains unchanged. Therefore, the height of the resultant P wave remains in the normal limit, but the duration is longer than 120 millisecond. A notch near its peak may or may not be present. Normal P wave morphology in the V1. P wave is typically biphasic in V1 with similar sizes of positive and the negative deflection. The V1 ECG lead is positioned at the fourth intercostal space to the right of the sternum, as the right and the left atrium depolarizes sequentially. First right atrium depolarized, then the left atrium depolarized. From the position of the V1, the right atrial depolarization wave moves towards the V1 lead, thus it shows the positive deflection, but the left atrial depolarization wave moves away from the V1 lead, thus it's showing the negative deflection. Thus, for the sequential depolarization of the right and the left atrium and also the position of the V1 lead responsible for the biphasic appearance of the P wave in the V1 lead. Right atrial enlargement in V1. As the first positive deflection denotes the right atrial depolarization, when there is right atrial enlargement that causes increase in the height, that means the more than 1.5 millimeter in V1 of the initial positive deflection of the P wave. left atrial enlargement, the terminal negative portion denotes the left atrial depolarization. Thus, in case of left atrial enlargement, the negative deflection due to the left atrial depolarization becomes wide, that is more than 40 millisecond, and also becomes deep, more than 1 millimeter deep. Biatrial enlargement. Biatrial enlargement is diagnosed when the criteria for both the right and the left atrial enlargement are present on the same ECG. That means in the lead 2 we'll get the P wave that is taller than the normal, that is more than 2.5 millimeter, as well as the duration of the P waves gets longer, that is more than 120 millisecond. In V1 we'll get there is increased height of the initial positive deflection more than 1.5 millimeter, as well as widening and the deepening of the terminal negative portion of the P waves. Common P wave abnormalities. The P mitrale or the bifid P wave seen in the left atrial enlargement. The presence of broad notched P wave in the lead 2 is the sign of the left atrial enlargement, classically due to the mitral stenosis. P pulmonale, peaked P wave seen in the right atrial enlargement. The presence of tall peaked P wave in the lead 2 is a sign of the right atrial enlargement, usually seen in the pulmonary hypertension. Inverted P wave. P wave inversion seen in the ectopic atrial and the junctional rhythm. P wave inversion in the inferior leads indicate a non-sinus origin of the P wave. When the PR interval is less than 120 millisecond, the origin is at the AV junction. When the PR interval is more than equals to 120 millisecond, the origin is within the atria that denotes the ectopic atrial rhythm. Variable P wave morphology. Variable P waves morphology is seen in the multifocal atrial rhythms. The presence of multiple P wave morphologies indicate a multiple ectopic pacemakers within the atrial or the AV junctions. If more than equals to 3 different P morphologies are seen, then multifocal atrial rhythm is diagnosed. If more than equals to 3 different P wave morphologies are seen and the rate is more than 100, then it is called multifocal atrial tachycardia.